Hi, this is Galit Goldfarb. Thank you very much for joining me here today. Today I'm going to be talking about curing carpal tunnel syndrome naturally with diet and lifestyle modifications and supplements. The nerve condition carpal tunnel syndrome is one of the most common upper limb nerve diseases and dysfunctions. It is estimated it has an estimated prevalence of about 4% of the population, with more women suffering from it at a ratio of 3 females to 1 male. Other risk factors besides being a female include obesity, diabetes, being pregnant, rheumatoid arthritis, hypothyroidism, any kind of connective tissue disease, and fluid retention, as well as, of course, genetic predisposition. And regarding repetitive hand and wrist use, it has not necessarily been found to be a risk factor. Carpal tunnel syndrome causes numbness and tingling in the hands and fingers. It occurs when the median nerve housed in the carpal tunnel becomes pressed at the wrist. The median nerve provides feelings for the forearm to the palm side of the thumb and fingers, and when it's irritated, the surrounding tendons compress the nerve, and this results in pain of the fingers and a tingling sensation. Many people with carpal tunnel syndrome say that their fingers do feel swollen. Chronic pain often leads to psychological symptoms as well in patients. Clinical anxiety and depression are significantly more common in people who suffer from carpal tunnel syndrome compared with controls in many studies. Identifying the single cause of carpal tunnel syndrome is challenging. Therefore, treatment types vary and include non-surgical, surgical, and other alternative methods. Some common non-surgical treatments include splinting, taking non-steroidal anti-inflammatory drugs, and other prescription medicines. Carpal tunnel surgery includes open release surgery and endoscopic surgery. Because over-the-counter prescription medications have potentially harmful side effects and also the seriousness of invasive surgery, many people with carpal tunnel syndrome prefer to explore dietary and natural remedies. So that's why we're here, and today we're going to be talking about the dietary and other natural treatments for carpal tunnel syndrome. So the first one, you want to increase your vitamin B6 intake. Vitamin B6 is involved in several metabolic pathways of neural function, and since the 1970s, carpal tunnel syndrome studies began to examine the potential benefit of treating carpal tunnel syndrome with vitamin B6. The results showed that the vitamin could improve symptoms of carpal tunnel syndrome because of an underlying nerve condition that was previously undiagnosed in these people that may be related to vitamin B6 deficiency. And also, vitamin B6 acts as an analgesic and it raises the pain threshold. Although none of these out of the 14 studies provided really A-class evidence, many supportive studies involved only a small number of subjects. But I still do recommend supplementing with vitamin B6, especially since it helps reduce the perception of pain. And vitamin B6 deficiency has been linked to carpal tunnel syndrome. The recommended dose is between 25 and 50 milligrams a day, which you can consume through healthy foods rich in this vitamin, such as non-GMO soya products, bananas, peanuts, whole grain wheat, and oats. Now, if you do decide to take a vitamin B6 supplement, be wary of any side effects such as nerve problems, feelings of depression, excessive tiredness, impaired memory, and irritability and headaches, because these are toxicity symptoms, and these will go away when you lower the dosage of this vitamin. Also, you want to increase vitamin D intake. Since carpal tunnel syndrome leads to chronic pain and psychological issues, vitamin D is neuroprotective, and scientists decided to investigate this vitamin and to see if any deficiency is common among people with carpal tunnel syndrome, and the findings showed that vitamin D deficiency was considerably more prevalent in patients with carpal tunnel syndrome, about 96%, compared with controls which had 23%. Also, statistical analysis showed that vitamin D deficiency is one of the independent risk factors for carpal tunnel syndrome. The study concluded that low vitamin D levels might trigger carpal tunnel syndrome symptoms. Now, supplementing with vitamin D reduces neurological injury. It protects the neurons from oxidative stress through its anti-inflammatory and antioxidant properties, so it is very well recommended. Vitamin D deficiency also leads to less intestinal calcium absorption, which could also affect carpal tunnel syndrome. I recommend supplementing with 1,000 to 2,000 international units of vitamin D daily if you live in a place where there is not sufficient skin exposure to UVB rays of the sun. And for people who leave the house completely dressed from top to bottom, or for people who do not leave the house very often, such as the elderly. You want to check out my vitamin D video for more information, and I'll include a link at the end of this video. You also want to take more antioxidant supplements. For example, alpha-lipoic acid is commonly used for nerve pain. It is an antioxidant and a neuroprotective, and it has it showed significant improvement in clinical outcomes of people with carpal tunnel syndrome. The effectiveness of alpha-lipoic acid as an antioxidant and neuroprotective increases when you take it along with curcumin, which is another antioxidant supplement. Also, vitamin C is an antioxidant and protective, protects the tendons. It's very beneficial for connective tissue. So you also want to supplement with vitamin C or increase foods with vitamin C in your diet. Also, you want to take into account that smoking delays healing due to its toll on antioxidant levels in the body. It is advisable to stop smoking to allow for speedy recovery with these recommended supplements. Also, you want to increase omega-3 fatty acid intake. Studies show the effectiveness of omega-3 fatty acid supplements, that they help reduce carpal tunnel syndrome related numbness and pain. An excellent way to include omega-3 fatty acid supplements, foods, is by taking sage or sea plant supplements that are rich in omega-3 fatty acids, or increasing your intake of food sources rich in these fatty acids, such as walnuts, chia, and flax seeds. Now, all of the supplements that I mentioned, the vitamin B6, the antioxidant vitamins, and the omega-3 fatty acid supplements, you must adhere to them for a minimum period of 3 to 6 months. Also, there are natural therapies. Acupuncture, an ancient Chinese healing practice that involves inserting these very thin needles through the skin, has been used to treat people with carpal tunnel syndrome, and it's said to reduce the symptoms, particularly chronic pain. Now, also, you may want to do some yoga. Yoga is believed to be very effective in carpal tunnel syndrome intervention, because the poses require stretching and relieve compression on the median nerve. Yoga practices also help develop better posture and are overall very healthy. In a randomized trial studying yoga-based intervention for carpal tunnel syndrome, the adults that participated in the trial for 8 weeks showed that the upper body was strengthened, and they had improvements in grip strength and pain intensity. And the researchers also reported claims of major pain reduction. So overall, to summarize, because of the over-the-counter prescription medication and other medications' potential side effects and the invasiveness of surgery, supplementing with the vitamin B6, vitamin D, vitamin C, alpha-lipoic acid, and curcumin, and omega-3 fatty acids have shown to have significant clinical effects for carpal tunnel syndrome, and is the best first line of treatment. But if you do go for carpal tunnel syndrome surgery, oral supplementation with these supplements before and after the surgery also holds significant benefits. So a change in diet, supplement intake, and lifestyle modifications, for example, stopping to smoke, are very empowering and have the evidence to lessen symptoms and also cure the disease. So I hope this video helped you, and if you found it valuable, please give it a thumbs up. Please also subscribe to my channel if you like this kind of content, and visit my website, thegorilladiet.com, for anything to help you move your health and wellness to a better place for you. Thank you very much for joining.